I was one of the people who was caught off guard. I had first heard about COVID when I was on the West Coast in February of 2020, ironically visiting Silicon Valley on a trip of mayors to a public health laboratory. And we were specifically given the advice during that tour of this public health startup that there's a public health crisis in the Wuhan province of China, but their projections is that it's going to be problematic in the Wuhan province, but if you're anywhere else in China, you're safe, and certainly in the rest of the world, this virus is not going to be spreading beyond China and largely within that one province.
So I've served in the U.S. Army for 20 years. So the opinions I share today are solely my own and don't represent those of DoD or the Army. But I'm specialty trained as an ER doctor. And so over the past year and a half now, we've dealt with COVID. And it's been hard. It's actually been, in many ways, much more difficult than my time overseas in Afghanistan. At least in Afghanistan, we had resources, and here, especially in the early days of COVID, we didn't have resources. We didn't have even PPE. Adequate PPE to deal with what was going on.
The pandemic was really hard. I think I went through medical school, residency, fellowship, junior attending level, or first years of work are just as hard as any training time. But this was the hardest last year and a half of my life in terms of just work. It was so hard trying to sort through all this, trying to make sense of all the information, all the science, and then physically the labor.
History told a different story, and we began hearing that story not from the Far East, but we actually began hearing it from our Italian-American residents here in Hoboken. I started getting calls and emails from some of our residents in Hoboken who were of Italian descent and who were in Italy at the time, literally telling me with fear and panic in these communications that, Mayor, this is something to be taken seriously.
One of the hardest parts of the pandemic has been, I think, the beginning when it started. It was so hard. It was so hard to think what's going to happen with the patients that we take care of at the bedside. Are we bringing this virus home? How are we going to be protected? How are we going to deal with the personal protective equipment or PPE? Is it going to be safe for a Sardar to wear this stuff and bring it home?
Hoboken was the first city in the country under my leadership to shut down the bars and restaurants because of the growing spread of the disease. And at that time, we only had one positive case of COVID. When we made that decision that ultimately was followed on a national level by mayors and governors across the country.
Many of us started making our wills, started thinking about what we're gonna do if we get sick. Are we gonna have to not only manage, who's gonna manage our kids, who's gonna manage our communities? And it was very, very frightening. And then even more frightening was we were in the know, but many people that we know did not know. And in the Sikh community, so many people are dependent on the physician and community leadership, the public health leadership. They're dependent on so many different aspects of information.
I remember in the early days of COVID, when we talked about PPE, there was a question of, well, how are you going to form a seal with adequate seal with a 3-ply surgical mask or even with an N95 mask? And whatever type of seal that you make, would it be adequate? And I think that question went through a lot of our minds, a lot of Sikhs and Jewish doctors and healthcare workers, a lot of Muslim healthcare workers also, I think that have to maintain their beards, also had sort of the same question: is my PPE adequate to deal with this very deadly pandemic?
I think all of us can remember the issue when some of these some of the Sikhs who decided to shave their beard and shave their hair so they could be protected better, they felt, with their personal protective equipment to serve. And that act became seen as an act of heroism. That one really hurt. It stung a little bit, because we really felt that, some of us really felt that our gurus would really want us to do our best to not lose our identity in the face of calamity. And our history illustrates that. We glorify a lot of our history, rightfully so, and we connect with so much of the history in which it's the easy thing to do to go and take the less resistant path. But many of us, and I credit my health system in which I work for, they went and got us personal protective equipment. They went and fought for us, and they made things, accommodations accordingly, that we felt reasonably safe.
Sikhi has really informed many aspects of my public life. I really stay true to the altruism that Guru Gobind Singh Ji said, which is really to recognize all of the human race as one. And that's a time-honored tradition in Sikhism that began with Guru Nanak, who really saw no stranger, saw no difference between a Sikh or a Muslim or a Hindu. And that is also very critical to the foundational documents that we have in the United States, in the U.S. Constitution and Bill of Rights, to recognize everybody as equal, to try to reach that more perfect union, and to make sure government pushes us towards achieving those ideals as a nation and as a Sikh mayor, through my faith, to be added strength towards those ideals.
Sikhi is a way of being a part of something greater than yourself. It's one of the reasons why I joined the army also, is because I wanted to be a part of something bigger. And my Sikh ideals are consistent with my army ideals, and that's helped me fight through COVID. On days when I'm exhausted and tired, and I've seen over 100 patients that day, it helps me push on and keep fighting, because I think that's who we are, right? I mean, we are all warriors. It's part of our DNA, and our gurus really taught us to transcend our individuality and look to community and connect with something greater.
I can't tell you how much I derived inspiration from our Sikh history, our Gurbani teachings, so much of what we learn about. I mean, all the Sikh teachings of the idea of Sangat. Our Sangat was amazing. Not just at the locals level, the national level. I could call up my friends, my colleagues, they would call me up, and we would all have deep dialogue and constant communication and support each other. Then you also had the idea of ego and home, that you had to really subjugate your ego and really battle against it to really recognize that, what am I here to do? What is my purpose? My purpose is to serve. And so our gurus teach us about battling the ego, putting it down, and really finding your true inner self.
More and more people find themselves searching for ways to make ends meet during this pandemic. Many worried about even just the basics, just being able to feed their family. Well, one Sikh organization in Queens is stepping up to help those in need across the city. Starting tomorrow, they'll be serving nearly 20,000 meals. Here's Eyewitness News reporter Naveen Dhaliwal.
Food being made at the Sikh Center Temple in Queens Village is a common sight as free meals are always served. But as the COVID-19 pandemic grows, these volunteers, gloved and masked up to prepare meals for tens of thousands in the city as they deal with quarantine, isolation, lack of money.
Our faith which tells us that no one should go to bed hungry. And it's inherited in us, in our blood. If we go to any Gurdwara throughout the world, we have been offering free meals, Guru Nanak's Langar, from past 550 years. When we saw the pandemic, we realized there is a need. There is a need of the food.
Incredible acts of kindness continue as we all band together during this coronavirus crisis. Alan Rascal met some Good Samaritans doing their bit to help the community.
Cooking up a little happy.
So don't worry. Be happy.
Melbourne's Sikh community rallying to prepare meals for delivery to anyone most in need, especially the elderly and the isolated.
They want to deliver the food for tonight.
The volunteers not only delivering meals, but also groceries. They also collect all the items needed to provide the free service.
We in Melbourne living as a big family, so we are helping our fellow members at this stage.
Worldwide, Sikh places of worship known as Gurdwaras offer free meals to anyone who shows up. It's known as Langar. It's a tenet of faith and a key part of the Sikh religion, which emphasises a concept of selfless service to the community at large. During COVID times, many lost their jobs or did not have enough to support or feed their families. But people around the world changed that. They donated food and money to charities, food banks and homeless shelters.
During the COVID pandemic, in particular the lockdown within New York City, there was a very strong sense of fear and worry amongst the community, in particular with our community that is immunocompromised or they were elderly and not able to go outside. As part of our SEVA, the CASA Aid team developed an online form that individuals were able to complete with requests for groceries. These were healthy, nutritious and vegetarian options. They would submit their grocery request and our volunteers would go out to the grocery stores. They would line up. They would be masked up with gloves and masks. We're taking all the precautions, but they would go out to the grocery stores, buy those items and then deliver them to the doorstep of the individuals that were requesting them. And this service was provided free of charge. We did this for 3 months, in particular for those individuals that couldn't go outside because they were elderly. They could not get access to online delivery because obviously, as you remember, those online delivery slots were full. There were individuals that were the vulnerable ones in our community, and we reached out to support them.
Every Sunday during the pandemic, the Sikh Society of Central Florida cooked meals and packed them into boxes. They then distributed the boxes to their local community and anyone else who was in need.
I'm out of work right now. I work in a restaurant and no work.
This is so awesome that you guys are providing free meals for families on Sundays.
ना को बैरी नहीं बेगाना सगल संग हमको बन आए ना को बैरी नहीं बेगाना सगल संग।
We got involved with the Langer about 3 years ago, and we were introduced to them by a good friend of ours, the late Pablo Santiago. He helped and worked with them, did a lot of community work with them, and he always came back so cheerful, spoke so positive, and he's the one who introduced us to them. And ever since we've been knowing them, and we connected well with them.
He came to us, and because we always serve the community, and we tell about the Sikh, how the stuff they do. So we thought it was a perfect match to work together. And as soon as we met, I was very amazed the way they interact with the family. Everyone worked. Everyone was involved, from the youngest one to the oldest one. It wasn't like no one had a title there. And for us, it's the same way with us.
जब ते साध संगत मोह पाई जब ते साध संगत मोह पाई ना को बैरी नहीं बेगाना सगल संग हमको बन आए सगल संग हमको बन आए जो प्रभ कीनो सो पल मान्यो जो प्रभ कीनो सो पल मान्यो एह सुमत साधु ते पाई एह सुमत साधु ते
पाई they give with expecting nothing in return, and they give with their open hearts, and to me that's amazing. We do the same. We're blessed. We have everything, and we give. We don't expect anything in return, so we really love them. They're really good.
Yeah, they've even inspired us even more so.
As the second wave of the pandemic hit India, it left the healthcare system there in turmoil. An acute shortage of medical oxygen followed.
Well, part of me was still part of me was still very taken aback when I saw how badly COVID infection took hold in India. That was really hard to see, and it was heartbreaking to see that. We still have friends and family in India, and to see how badly their public health initiatives were definitely gave me pause.
इस टाइम जो आप देख सकते हैं ऑल ओवर इंडिया पे इस टाइम जो ऑक्सीजन का जो पैनिक कोरोना ने अपना पैनिक यहाँ पे लोगों को मरने पे सड़कों पे डाल दिया है, उसके लिए हमने एक सेवा चालू की है, ऑक्सीजन मोबाइल सेवा। ऑक्सीजन मोबाइल सेवा मीन्स हम आपको सिलेंडर या कुछ भी प्रोवाइड नहीं कराएंगे, आपके जो पेशेंट को गाड़ी में ही हम ऑक्सीजन प्रोवाइड कराएंगे और वहीं पे हम उसकी जान बचाएंगे। अभी तक करीब 36 और पार हो चुके हैं, राउंड 700 पेशेंट्स की हम यहाँ पे जान बचा चुके हैं।
Free drive-through oxygen langars were provided all across northern India. They were literally breathing life into COVID patients with dangerously fluctuating oxygen levels as the pandemic hit India tragically hard.
इसलिए आना पड़ा कि और कहीं व्यवस्था नहीं हो पाई, तो यहाँ से पता लगा कि गुरप्रीत जी ये बहुत अच्छा काम करा रहे हैं सर। मैं यहाँ पहले पूछ के गया, उन्होंने तुरंत लेके आओ, अगर ऐसी समस्या है तो हम इसी काम के लिए बैठे हुए हैं।
कोई बंदा ऑक्सीजन के बिना नहीं मरना चाहिए। ऑक्सीजन बड़ी छोटी सी चीज़ होती है जो आज बहुत बड़ी लोगों के लिए समझ लो एक भगवान या एक समझ लो कि अवतार है कि ऑक्सीजन मिल जाएगी तो बंदा बच जाएगा। उसी ऑक्सीजन का हमने लंगर लगाया हुआ, बिल्कुल फ्री, कोई 1 रुपया किसी लिया नहीं जाएगा। जो आएगा हम उसका कार्टेज भी देंगे अगर वो बेयर करने के लायक नहीं है।
I would say the same thing for our Sikh Sangat. They were just so good about stepping up, being supportive. I remember one time we lost someone in India and I just started crying. I was teaching a Gurmat school class and I just emotionally started crying because we had just lost a member of our Sangat. And this was he was in Delhi at the time and got sick. And he succumbed to the virus. And I remember just crying during teaching the class. I just broke down. And my brother called me, essentially. My Khalsa brother called me and just asked me how I was doing, catching up. And he's just like, you've been through so much. And I really appreciated that. I connected with him in a manner that I couldn't connect with other people at my work. And to share in that was really meaningful.
What do people need now? You don't need a langar for just food because we were assuming that oxygen or the air we breathe is taken for granted. And today, this pandemic and this crisis has shown us that that's not taken for granted, that people can't get oxygen. So to actually think outside the box and to think of, you can just go in and get a helping of halwa or get a helping of food. And here you have that you can actually get a helping of life, that you can actually go and get air is absolutely unbelievable. And I'll give you a small example. We had a very senior IAS officer whose nephew was ill, and we were trying to get him a bed in Gurgaon. And then I spoke to his wife and I said, did you manage? We said, he's okay now because we at least managed to get him in the car to a Gurdwara and managed to give him oxygen for a few hours. So I think that this kind of SEVA, this kind of, I would say, pillar in the community that the Sikhs have been always in terms of food, and they've stepped it up today in terms of just giving life. And this has really proved life-saving to everyone, has taken the idea of SEVA and the idea of protection to the needy and the protection and charity to the needy and the oppressed to another level. And, today when we look at India and we look at sort of everything is exclusive and everything is divisive, and to have this kind of SEVA, just no questions asked, unconditional, I think they have made India a better place and they've made us a better people.
Cremation is the process where an individual's corpse is burnt to ashes. This custom is practiced by a vast majority of Hindus and Sikhs across India. By April 2021, thousands of bodies were being cremated every day, a drastic increase from when the first COVID wave hit the world in 2020. Once the deadly Delta variant began to spread rapidly across India, the overall death toll by the beginning of July 2021 rose to more than 400,000 lives. Piles and piles of lifeless bodies lay everywhere. Many were not able to see their loved ones for their last time. It was too dangerous to enter an area where the dead bodies of COVID patients were cremated.
ਦਾਤੇ ਹੱਥ ਵਡਿਆਈਆਂ ਜਿਸ ਭਾਵੇ ਤਿਸ ਦੇ ਸਾਹਿਬਾਂ ਨੇ ਜਿਹਨੂੰ ਮਾਣ ਬਖਸ਼ਣਾ ਹੈ ਉਹਨੂੰ ਹੀ ਇਹ ਸੇਵਾ ਮਿਲਦੀ ਹੈ, ਬਖਸ਼ੀ ਜਾਂਦੀ ਹੈ। ਮੇਰੇ ਵਰਗੇ ਤੇ ਕਰੋੜਾਂ ਹੈਗੇ ਹਿੰਦੁਸਤਾਨ ਦੇ ਵਿੱਚ, ਲੇਕਿਨ ਮੈਨੂੰ ਹੀ ਸੇਵਾ ਬਖਸ਼ੀ ਸ਼ਹੀਦ ਭਗਤ ਸਿੰਘ ਸੇਵਾ ਦਲ ਨੂੰ ਹੀ ਬਖਸ਼ੀ। ਮੈਂ ਸਮਝਣਾ ਇਹ ਗੁਰੂਆਂ ਦਾ ਸਾਡੇ ਤੇ ਆਸ਼ੀਰਵਾਦ ਹੈ। ਜਦੋਂ ਪਹਿਲਾ ਪੈਂਡੇਮਿਕ ਆਇਆ ਤਾਂ ਅਸੀਂ 1362 ਕ੍ਰਿਮੇਸ਼ਨ ਕਰਾਏ, ਅਬਾਊਟ 2000 ਪੇਸ਼ੈਂਟ ਨੂੰ ਆਪਣੀ ਸੇਵਾ ਦਿੱਤੀ। ਉਹਦੇ ਵਿੱਚ ਮੈਂ, ਮੇਰਾ ਪੂਰਾ ਪਰਿਵਾਰ, ਸਾਰੇ ਅਸੀਂ ਕੋਵਿਡ ਵਿੱਚ ਚਲੇ ਗਏ ਸੀ। ਇੱਕ ਡਰਾਈਵਰ ਮੇਰਾ ਸ਼ਹੀਦ ਵੀ ਹੋ ਗਿਆ ਉਹਦੇ 'ਚ, ਇੱਕ ਡਰਾਈਵਰ ਸਾਡਾ ਡੈਥ ਕਰ ਗਿਆ ਉਹਦੇ 'ਚ, ਲੇਕਿਨ ਅਸੀਂ ਪਿੱਛੇ ਨਹੀਂ ਹਟੇ ਕਿਉਂਕਿ ਗੁਰਬਾਣੀ ਯਾਦ ਸੀ ਨਾ ਕਿ ਜੇ ਕੋ ਪ੍ਰੇਮ ਖਿਲਨ ਕਾ ਚਾਓ ਸਿਰਧਰ ਤਲੀ ਗਲੀ ਮਰਿਆਓ, ਇੱਕ ਮਾਰਕ ਪੈਰ ਧਰੀ ਜਾਏ ਸਿਰ ਦੀਜੇ ਕਾਂਡ ਨਾ ਕੀਜੇ। ਅਸੀਂ ਕਿ ਹੁਣ ਪਿੱਛੇ ਨਹੀਂ ਹਟਣਾ, ਹੁਣ ਕਾਂਡ ਨਹੀਂ ਖਾਣੀ ਅਸੀਂ ਤੇ ਹੁਣ ਮਰ ਵੀ ਜਾਈਏ ਇਹਨਾਂ ਦੇ ਪਿੱਛੇ ਨਹੀਂ ਹਟਾਂਗੇ। ਹੁਣ ਜਦੋਂ ਦੁਬਾਰਾ ਪੈਂਡੇਮਿਕ ਆਇਆ ਦੂਜਾ ਵੇਵ, ਇਹ ਬਹੁਤ ਜ਼ਬਰਦਸਤ ਆਇਆ ਜੀ। ਇਹ ਇਤਨਾ ਜ਼ਬਰਦਸਤ ਸੀ ਕਿ ਅਸੀਂ ਸਵਾ ਮਹੀਨੇ ਦੇ ਵਿੱਚ ਹੀ ਜਾਂ ਮਹੀਨੇ 'ਚ ਹੀ ਕਹਿ ਸਕਦੇ ਹਾਂ 2600 ਡੈਡ ਬੋਡੀ ਕ੍ਰਿਮੇਟ ਕੀਤੀਆਂ, ਜਿਹੜੀਆਂ ਪਹਿਲੇ 6 ਮਹੀਨੇ 'ਚ 1300 ਕੀਤੀਆਂ ਸੀ 1300। ਅੱਜ ਅਸੀਂ 2600 ਨੂੰ ਕ੍ਰਾਸ ਕਰ ਗਏ ਵਿਦਿਨ 1 ਮੰਥ।
Sikhism is a religion founded on principles such as equality and the 3 golden rules of Naam Japna, remembering God at all times, Vand Shakna, sharing with the needy, and Kirt Karni, earning an honest living. Growing up, Guru Nanak was appalled by the caste injustice surrounding him and proclaimed, Ek Onkar, God is one and all. all the communal strife around us is pointless, as there is one God who exists in every living thing. While travelling throughout Asia in the 1500s, Guru Nanak preached these ideals. He reminded us that all people are inherently divine and created equal by one Creator.
Guru Nanak, he himself take pilgrimage to Mecca. That shows religious harmony. And then also, you see, among his followers, no caste system. That's a great thing. So I wholeheartedly admire Sikhism.
Earlier this year, I was diagnosed with metastatic cancer. So my immune system is very weak. With each passing day, it gets weaker. And so at some point I won't be able to work anymore. But Sikhis taught me to remain resilient and remain strong. And I think work, and being a physician makes me stronger. So at some point, I'll have to stop working because I'll be too sick. But I'll keep fighting. I'll keep fighting for as long as I can.
May this pandemic awaken us to the truth. We are one global human family. May we be brave in our grief. Let our tears flow, tend to each other's wounds, and begin to reimagine a world where no person is disposable and we see no stranger. For this, we lift our voices in one song to the divine within us and all around us, and rise together. A universal prayer by the fifth Guru of the Sikhs, Sabe ji Samal Apni Meher Kar.
अपनी मेहर कर अपनी मेहर कर अपनी मेहर कर अपनी मेहर कर सबे जी समाल सबे जी समाल अपनी मेहर कर अपनी मेहर कर मुझ पाए दुख दालद पन तर दुख दालद पन तर अपनी मेहर कर अपनी मेहर कर अरदास सुनी दातार होई शिष्ट ठर शिष्ट ठर अपनी मेहर कर अपनी मेहर कर ले वो कंठ लगाए ले वो कंठ लगाए अपदा सब हर अपदा सब हर अपनी मेहर कर